Before we go through this lecture, what is one thing that you can do? And then we'll move on with the lecture here. So, all right, so our objectives is we're going to talk about how to recognize things that are safe versus unsafe. We're going to compare and contrast those. We're going to talk about what makes a resident so high risk for injury, what puts them at further risk. And then we're going to talk about some preventions that we can do and some interventions that we can do to help keep our patients and our residents safe. So I want y'all to kind of think for a second. We are going to go into this clinical site in Adams Farm. Anybody ever been there before, by the way? Okay. So we're kind of going in. The first night there, we'll get you guys through orientation and everything, but I want for y'all to have some takeaways from this lecture. Remember that even though this is our clinical site, it is their home. It is some of their homes. And I think you guys would be very respectful of when we go in there, and then also be able to follow rules, follow the protocols, follow the policies in place, and then also to remember the golden rule. I think that's very, very important. Think of the person that you love the most right now off the top of your head. Think of the person that you would do anything for. Picture them in this setting, and then picture you taking care of that loved one. If they lived in that place, how would you want your loved one treated? That's how I treat all of my patients at my hospital. I say, if that was my grandma or that was my grandpa, how would I want them treated? And so just to kind of, even though it's our clinical site, it's their home. So let's be respectful when we go in there. I know everybody will be doing that. Okay, so residence unit consists of a few things, as y'all learned about in your module C. They have their own personal care items. Some of them will, some of them won't. You'll be surprised how many of them may or may not have things that family has brought in, and how kind of like, I know, how kind of like the CNAs kind of rally around. And I have a couple stories to kind of tie in some of the concepts that we go over, but I remember specifically there was a resident there. Her family only came and seen her on Christmas, and they lived like a few miles down the road, and it was just really, really sad. She had dementia. She was very combative, but the stuff in her closet was like bare minimum. I mean, really, the staff just kind of had to, be her family. The staff became her family, and it was funny because her roommate had everything. Her roommate was actually in her 50s. She had had a stroke, and her parents were the ones that were coming in to see her in the nursing facility. They brought her everything, her favorite candies, her favorite lotions, stuff from Bath and Body. I mean, it was just very different, is very contrast to the other residents' lifestyle and what she was going through. And so just remember that sometimes they may have family there that comes in season, sometimes they may not, but they are allowed these personal care items. They'll have a privacy curtain. There will be furniture in their rooms and equipment. Just picture like what you have in your home. That's what's going to be similar there, except for they're probably going to have their call bell system, and we don't have that. We have phones, and we can text our whoever, hey, bring me this or bring me that, okay? So what can be a hazard? I know we've discussed this a little bit before, but anything that can basically cause the resident illness or injury, whether that's we're using equipment that is not working appropriately, that we should maybe take out of service and have them look at it. Fall, anything that's like a slipping or tripping hazard, like a rug or something rolled up, cords. We talked about faulty equipment. Temperature, when you're doing your bed bath or you're doing your partial bath, making sure that that temperature is not too hot for that patient and not too cold. Fire safety, making sure we know where our fire exits are, and when we go on our first night, we'll get like a really good tour, so you guys will know exactly where things are. You'll know where bathrooms are. You'll know all those good things. Patients trying to leave the facility. I had when I was at NA, I had worked at this nursing home for quite a while, and we had a little resident who was known to wander, and she would probably every shift I worked, she would get down the 400 hall, and she'd have just enough strength to push open that door, and now all the bells and whistles and everything goes off, and oh, that's Valley. She's down there at the end of the hallway, and so we'd run and go get her and have to bring her back. But that is what you might see here in clinical. Also, I have Cleo's story, and y'all are probably thinking, who the heck is Cleo? Cleo was one of my favorite residents that I cared for. And I specifically remember her because she was one of those wanderers. She would wander into somebody's room. Wasn't her room. She would crawl in that bed with that patient, and they would be like, who are you? You are not my roommate. But anyways, one day, somebody had left out some Vaza cream, which is basically like Desitin that they use at the facilities. And what she had done was she was hungry. So you know what she did? She put it on her and just started eating Desitin cream. And so I say that is because when we do anything at the bedside, we're caring for them, things that don't need to be within their reach, we go ahead and put those things up. So if it's a lotion or if it's something specific for them, their dentures, making sure those things are kind of put up. But I will never forget that. I just remember going down the hall and here she is like smiling at me, no teeth, no teeth, thank goodness, because them dentures would have been nasty. But just having a mouthful of Desitin cream, basically. This slide represents my feedback from Ms. K, and this slide represents the course evaluation form. But and also, guys, don't be afraid to, if you see something, to say something. You're going to be paired up with an NA some nights, or you know, Ms. K, myself will be out there on the floor. So don't be afraid to come to us, even if you think it's just a small thing. Bring it to our attention because it may actually be something that warrants further investigation. Okay. So tell me why, before looking, tell me why you think our elderly are at most risk. Think of your elderly loved ones. Are they the most steady?
No.
Do they move really fast? They try to move fast. Yeah, so they have that slower movement. Maybe not thinking as clearly. Maybe they've had some cognitive changes. Yeah, their balance is off. Think about visual impairment. Think about your five senses. All those kind of decrease as you get older. You know, your vision, your hearing, your smelling, your taste, your touch, all those good things. Also, side note, do y'all know what the last sense is that goes, that leaves the body when somebody passes away? Hearing. And you guys, y'all may see that, y'all may not see that. So just be cognizant of that when you're going into the Adams Farm, that if you are paired with somebody who you may be doing end of life care or maybe doing some comfort care things on, that they can still hear you. So still talk to them, act like everything is perfectly normal with them that's going on. That's really hard to do. But we'll be there to help y'all navigate through that. So safety is everybody's job. Everybody's job. It's not just, oh, there's some water on the floor, environmental services will get that. No, it is everybody's job to maintain our residents and staff safety. So what can you do to provide safety? Some key things that we'll be doing in part of our interventions, we're gonna help keep their rooms clean and tidy, help keep them clean and tidy, making sure that where they're staying at is well lit, they can see good, they have everything that they need within reach, providing comfort to them, whether that's turning them on their side or giving them a warm blanket. And then we always want to give our residents a choice when possible. A lot of times they're told when they can leave their room. I know when COVID had initially hit and they had pretty much shut down all visitation with them, those poor people were sitting in those rooms, those four walls every day, all day, could not leave to go to the mess hall to eat, could not go to any activities. It was really, really sad. Family members were actually having to come to the outside, like if they were able to have like an outdoor window, their families were having to communicate through them for that window. So I'm glad we have kind of, been able to navigate the pandemic a little better now. But just think about, they're told when they can go eat. They're kind of on this routine of, I go to the bathroom, do that. And also keep in mind that we don't want to disrupt their routine. So if they're used to going to bed at 6:30, they're used to going to bed at 6:30. They're used to having their blood sugar checked at 7 o'clock. The blood sugar checked at 7 o'clock. Different things like that. So just remember, we are guests in their home. All right, oxygen. What is your role when oxygen is in use? Anybody think back to what our role is?
Make sure they don't take it out.
Make sure they don't take it off. If they have an order for it, make sure they keep it on. Do you think it's a good idea to have some signage in place so people know that patient is on oxygen? Some key safety points and this goes for all of our patients, whether they're wearing oxygen or not. Caring for the right resident. So again, your NA is going to know exactly who all of those residents are. They know them like the back of their hand. So making sure that we're caring for the right resident each time. Lock in our wheelchairs before we transfer a patient, and using proper body mechanics to help lift and assist them. Again, checking their water temperature before we bathe them. Making sure we keep an eye out for our wandering residents that we might encounter. And then environment, our bed always in the lowest position. And then arrange their room to where it's easy for them to navigate about. Some of them may not be totally like need all of our help with every single thing. They may be in a wheelchair, but they might be able to lock their own wheelchair, maybe be able to transfer themselves to the bed. So we want to be cognizant of that too, just making sure that we know our resident, we develop a rapport with them, and kind of get to know what they can and cannot do. And that's where your NA that worked with them is going to kind of come in. And then always what we do at the end of every skill, we give them their call light, making sure they have those vital things within reach. The great aim of education is not knowledge, but act. Herbert Spencer.